Hi, I'm Tamara Thomas, content editor for Urban Health Today, and I'm speaking today with Dr. Susan Bailey, an allergist immunologist from Fort Worth, Texas, and president of the American Medical Association. She's speaking with me today about the impact of COVID-19 on the Latinx community and its lack of visibility on the national stage. Thanks for talking to me today.
Thank you so much for having me.
So, my first question is, can you lay out some of the data regarding the drivers for health inequities in the Latinx community for COVID-19?
Sure, we don't have complete data yet, but the picture of the COVID-19's devastating impact on the Hispanic community is really starting to become clear. And we issued a report in recognition of Hispanic Heritage Month last month about the disproportionate effect of COVID-19 on the Latinx community. And we found that while Hispanics account for 18% of the US population, they make up 33% of the nation's COVID-19 cases. We also discovered some very specific structural and social drivers to this vulnerability. Some of the structural drivers include restrictive healthcare insurance access, poorly funded safety net architecture, socioeconomic vulnerability due to the overrepresentation of Hispanics in low-wage labor markets, invisibility from national discourse and lack of public health surveillance data to capture this information, and of course, anti-immigration policies and rhetoric. But some of the social drivers are lack of timely, accurate, and culturally appropriate Spanish language COVID-19 resources, limited access to multilingual and culturally responsive digital health technologies, not enough COVID-19 testing in Hispanic communities, increased police and immigration enforcement in Hispanic communities amid the pandemic, and a limited availability of Hispanic physicians to provide culturally appropriate care and education.
Let me just ask another question. I'm just trying to conceive how this is possible, because when the test is done, that information is aggregated somewhere, yes? So,
Yeah, but initially, during the pandemic, the racial and ethnic data was not being collected at all
hmm,
on anybody. And the AMA urged the federal government to prioritize gathering this data so that we could really document the disproportionate effects. And much of the focus initially was on the African American community,
hmm,
and the really the evidence of the disproportionate effect on Hispanic communities really didn't start coming out until later on in the pandemic. And now, especially in some parts of the country, I'm in Texas, Houston, the South Texas area has just been a dramatically severe on the Hispanic population.
hmm. Okay. So how are these disparities exacerbated by unequal or insufficient discussion?
Well, we know that COVID-19 didn't create the circumstances that have led to the inequities that the Hispanic community faces, but the report that we wrote clearly highlights how the pandemic is perpetuating these inequities. And even though the Hispanic community is the largest ethnic group in the country, we still really haven't done enough work on the impact of COVID-19 in this population. The Hispanic community has kind of stayed invisible in the mainstream discussions, and so as a result, have not gotten the proper attention they needed in pandemic recovery and prevention planning. It's like the Hispanic community, it's the otherness of the Hispanic community. This term of otherness implies that the community is not part of the American narrative often, and is excluded, and which leads to increased social marginalization through exclusion from the national discourse, and results to the kind of erasure of the Hispanic community, from our conversation.
Hmm. So are they going for testing at the same rates as everyone else? Or because I know, for example, here in New York, um, there's a fear, for example, of going um, to get care because they're afraid of how they're going to be received or treated, or maybe there's no Spanish language provider, and so they stay away. Are they getting the results? Are they going for testing at the same rates as everyone else, or?
I'm not sure we've really got that data, but that is I think all of us suspect it, and I think that that's a significant concern. And so, one thing that we want to be able to do is support healthcare providers, public health specialists, to be especially aware of the special needs of the Hispanic community, and give them the tools that they need to care for these patients within these communities.
So what can HCPs and public health specialists do specifically to support the community during the COVID-19 pandemic?
Well, the AMA has worked very hard to support physicians and healthcare professionals caring for patients within these communities. And we need to learn from every single thing that happens along the way so we can better prepare for and prevent crises like this in the future. But near the beginning of the pandemic, the AMA created an online hub that had various health equity resources and tools necessary for physicians and healthcare professionals to navigate this changing landscape, posed by the COVID-19 pandemic, and to try to advance equity across all aspects of the healthcare system while still providing critical care for patients. And this website includes updated links to resources for non-English speakers, demographic data, guidance, recommendations, and strategies to address questions like what kind of role public health leadership should play in national response efforts, and how to recognize physician bias and things like that. Now, of course, change isn't going to happen overnight, but overall, the AMA's efforts are focused on initiatives, first of all, medical school admissions policies, helping make sure that medical students look more like the US population, to make sure that all physicians have access to trusted educational resources that are related to health equity, and make sure that marginalized innovators have equitable access to healthcare venture capital, startup development opportunities, things like that.
So what can you do collectively to get this data to become part of the national discourse?
Well, first of all, gathering the data and disseminating it. Our report identifies and provides guidance for understanding the opportunities that physicians and other healthcare professionals have for working to serve the Hispanic community in a more equitable manner. And there's some things like, being aware of and combating misinformation that's shared within the Hispanic community, to coordinate outreach efforts to make sure that culturally appropriate public health education campaigns and services are available. We need to create consistent, culturally appropriate public health campaigns and informational materials that are inclusive of all populations, like, answering questions about how to quarantine, where to get tested, what symptoms to pay attention to, how to access telemedicine, and things like that. We need to leverage the trusted community outlets, Spanish language news and radio, social media communities, schools, things like that. We need to make sure that physicians have a complete set of culturally responsive resources, making sure translation is available, for example, and just in general, advocating for broader change to advance health equity for all marginalized groups.
Okay. Um, so the AMA's Center for Health Equity discusses eliminating health inequities as a priority of theirs, and you've laid out some of those recommendations. But what does that look like in practice? And how much of it is sort of what percent would you say, how much is kind of being done now? Where are we in that process?
Well, the AMA is leading an aggressive effort to embed equity into all of our thoughts, all of our actions, and our organizational processes so we don't unintentionally perpetuate inequities, but help people live healthier lives, all people. And so the creation of our Center for Health Equity in 2019 has expanded greatly, and it's working to achieve optimal health for everyone by providing ongoing resources, research, education about critical health and social issues that are impacting marginalized communities. So there's a great deal that's going on right now. We're building alliances and trying to improve engagement between communities. We're trying to make sure that there are equitable opportunities and conditions and innovation for marginalized communities, to push upstream, if you will, including into medical education to address all the determinants of health, especially the social determinants of health. And an example of the steps that we've taken, the AMA Board of Trustees, the leadership of the AMA, pledged action to confront systemic racism and police brutality, recognizing that racism in its systemic, structural, institutional, and interpersonal forms is an urgent threat to public health, the advancement of health equity, and is a barrier to the excellence of delivery of medical care. And specifically regarding COVID-19, we talked about the hub that we've got on our website. We've also got a case study initiative project that's collecting insight on initiatives that aim to center equity in COVID-19 responses. And we have a weekly web series called Prioritizing Equity that invites a panel of healthcare professionals and equity experts to discuss COVID-19 and other determinants of health that uniquely impact marginalized communities, public health, and health equity. We believe that everybody deserves optimal health, and we're working to ensure that all people and communities can reach their full health potential.
And what are some, and this will be my final question, Doctor, what are some recommendations for identifying public health opportunities to engage the Latinx community and increase effective outreach to them?
I think the first step is to have dialogues like we are doing right now with our prioritizing equity weekly web series. We've been working with the Hispanic Medical Association. We have within our AMA a minority affairs section, which is very active and provides great opportunities for connection with various communities. I think at this stage of the game, it is all about communication, which has been made difficult in this pandemic since it's so hard to get together. But spreading the word in any way that we can on the web and through our writing, however, is just to get the word out to work together.
That's impressive. This is a much needed discussion, and I hope this reaches, a national discussion, because it is being largely ignored, and it's time that this becomes part of the conversation. It's just mind-boggling that it's not.
Mhm.
Well, Dr. Bailey, thank you so much for your time. I really appreciate this, and I hope we can talk again about it.
Yes, that would be great. Thank you so much, and stay safe.
Thank you. You too.